Hi there, I'm Dr. Angela Moradian, and my office number is 516-364-1444, and my email is drmsmiles@optimum.net. It's drmsmiles@optimum.net. And once again, I'm stuck in traffic on Mother's Day, Sunday, and I thought, what could I do in this couple of minutes here to make the most out of it? So I wanted to discuss a topic which sometimes gets a little ignored, and I think the general public doesn't realize the impact that it has on the entire health of an individual. And the topic is really, it's bacterial infections in the mouth and how it affects the rest of your body. In the mouth, we have the gum and the teeth, which can harbor certain bacteria and viruses, and we need to be aware of it. There's also the fungi in the mouth as well. That's a whole other topic altogether. One of the main bacterial infections that we get in the mouth is periodontal disease, gum disease, and it does need to be treated. It's important to go to a professional. You can't do this at home with any rinse or anything that you buy over the counter. You just cannot treat periodontal disease that way. So what you would need to do really is go to a dentist, and a hygienist and a dental professional will help you come up with a treatment plan. And depending on the severity of the gum disease, you can have initial phases are scaling your root planing. You could start with those. And there's different adjuncts with treatment. And every office will offer you different treatment modalities at that level. There's also gum specialists, which will go further with the treatment. They might also offer you some surgical options for gum disease, which will eliminate pockets, bleeding, and inflammation. The point of periodontal therapy is to reduce the inflammation and therefore reduce the amount of bacteria in the mouth and in the sulcus. There's a space between the gum and the bone and the tooth, and that's called a sulcus. About 3 to 4 millimeters is what's healthy. Anything above that, 5, 6, 7 millimeters, that's a big space, so it's going to harbor a lot of bacteria. Now, the importance of this is that at home you can really only clean up to 3 to 4 millimeters. So anything above 5 is going to be considered something that you may have to treat. And again, it's very important to make sure that gum disease is treated. You cannot leave it untreated. And there's a very strong correlation now with gum disease and other diseases in the body. Again, we are still at the tip. There's a lot of research that's going on with that, and we're finding out so much about it now, and we're realizing that bacteria in the mouth can affect other parts of your body. The other bacterial infection that you can have is on a tooth, through the nerve of the tooth, in a sense. You can have a root canal that has gone bad, or a tooth that just the tissue inside kind of dies off and it becomes dead in a sense, and then the body reacts to that, and you can have, if it's open into the mouth, you can have bacteria traveling that way into the body. So these are treated as well with a dental professional. You must see your dentist immediately for these. This is where root canals are done, and other treatment modalities, including extractions at times. So the bacteria in the mouth does travel and can travel into the rest of our body, and we must take care of it, must reduce the amount of bacteria that's in there, and any active infections, bacterial or tooth infections, must be treated. So I hope this can explain a little bit more the importance of basically going to your dentist, who will determine whether or not you have any of these in your mouth. And you will follow through with the recommended regimen to make sure that you are reducing the bacteria in the mouth. So like I said, if you have any questions about these things, you can always email me. We're open to any questions that you may have. And again, it's the treatment for gum disease varies from patient to patient, and that is a chronic infection. So a lot of times it's not a one-time thing with periodontal disease. You may have to go back on a regular basis to maintain it and to make sure that it stays healthy. And it's a big commitment on the patient's part and the doctor's. So I hope that helps. If you have any questions, like we said, you can always call us. Thank you. Have a good day. Bye.